Hi there, well I survived surgery, feeling fabulous. Actually I'm a little bit sore, but it's not that bad at all. I'm back in my room now, going to recover. Keep watching for updates. Thank you.
Hello there, how are you doing? Well, I've been out of surgery now for a week. It's been a week since I left hospital, and I had surgery because I had a condition called calcific tendonitis. Now, it affected both sides, my right side here and my left side here. 5 months ago, I had surgery on my right side, and a week ago I had surgery on my left side. I had calcific tendonitis. It basically means calcium deposits grow around the rotator cuff area of your shoulder. And of course, it turns to a cement-like, bone-like substance. It cuts movement. It does a lot of things, and it's really painful, particularly if you have a flare-up. Now, it tends to go on its own with a lot of people. Other people, it goes with cortisone injections or physiotherapy. A very small percentage, such as myself, need surgery because it just keeps getting worse no matter what you do. So I had the surgery a week ago. Now, I won't go into too many details because in one of the videos I made 5 months ago when I had the first surgery on my right side, I gave a lot of what had happened and I went into more of the specifics. But it was the same, you know, the registrar meets you, you go up, you talk to the surgeon, you talk to the anaesthetist, you put your gown on and everything, you get weighed, you do your x-rays. I went down to surgery. I was a lot less nervous because I've done it before and it was all fine the first time round. So although of course I was a bit nervous, I'm not a fan of hospitals, even though I think they're amazing places and do fantastic work. I was a lot less nervous and it helps a lot. I know it's easier said than done to be not nervous, but it helps. So I went down, I asked for gas. I have a horrible phobia of needles and I was given the gas. It felt like dropping into a wonderful, wonderful sleep. If you don't like needles, do ask your anaesthetist if you can have gas. And when you see the surgeon and an anaesthetist before surgery, be very honest. Talk about your fears. Don't hold back. So the next thing I know is I'm waking up from surgery. I'm looking around the recovery room. There were 2 other patients in front of me. Now I could see they were quite elderly. And the first thing I remember is I was shaking. I was really shaking, but I wasn't panicking. I was quite relaxed. But I remember saying to the nurse, I'm shaking, but I didn't feel worried about it. It was involuntary. And I didn't feel particularly cold, but from what I understand, a certain amount of patients, when they wake up from surgery, they do start shaking. It's about your body adapting to the temperatures, because apparently the body temperature drops when you have a general anesthetic, so it's really adapting to the room temperature. So I was shaking, plus, unlike last time when I woke up, where I just felt a bit of discomfort and felt quite tight, it did sting. My left shoulder did sting, but what they did was they put blankets over me, they put a heater which blew hot air over me, and I don't know if they put some more medicine into my cannula and the IV, the intravenous drip, but the stinging sort of went quite quickly. I went back up to my room. I met my friend who was waiting for me. They did the usual things, check your blood pressure and all that. My blood pressure was a bit high, but we reckoned that was to do with the adrenaline, to do with a bit of the nerves and everything. But I was fine. Of course, the usual discomfort and all of that. But I had a nerve block. That means you can't feel anything. It's totally numb, which is fine, which is brilliant and does help. And I had a sling on me and all of that. So it all went fine. At about 4 in the morning, they came and they changed the dressing. They took the big dressing off, and you would have just seen it in the photos earlier. And then they put some small plasters, bandages on the wounds. I believe there's about 3 or 4 incisions. Now, let me tell you the exact surgery I had. Now, it's quite technical, but I'll explain it in layman's terms. I had a left shoulder keyhole arthroscopy, subacromial decompression, and excision of calcium as required. Now, what does that mean? Good question. They open me up, put a camera in, about 3 or 4 incisions. I believe they made 4. They look around. It's all done on the screen. They look at the screen. They remove the calcium that's in there that's causing a lot of problems. They reshape some of the bone structure, such as the humerus, because the calcium has damaged it, and they create a bit of space in the area for the muscle. So it's quite complex surgery. I think people who can do keyhole surgery are nothing short of amazing. So at about 4 or 5 in the morning, they changed the dressings. Finally, at about, what was it, maybe 7:30 or something, they took the cannula out. I don't like having a cannula. It wasn't particularly painful, but they took it out. And then I went home. Before I went home, the physio came in, showed me exercises, pendulum exercises, swinging the arm around and all that, and a couple of stretching exercises that you can do on your bed. I won't go through them now, but if you watch one of the earlier videos I did 5 months ago when I came out of the original surgery, I actually demonstrate the exercises. Now, when I spoke to the surgeon that morning, because he came in before I was discharged, he said it was more serious than expected. There was more calcium. In fact, he reckons there was more calcium than the original surgery. Now, the specialist thought the calcium case, the calcific tendonitis that I had, was the worst case he'd seen. The surgeon thought it was one of the worst. So I dread to think how bad this side was if it was considered even more serious. But anyway, unlike last time where I stopped taking painkillers the day after surgery, I have needed them this time round at night time, because where the calcium was, it's on the bit that I lie down. So although I had flare-ups on my right side, and that was agony, it was never in the bit that I lie on. So I never had too many problems lying down on my right side, except when I had agonizing flare-ups. This side, though, it has been sore, so I've been taking paracetamol at night, 2 paracetamol at night, which has hurt a bit, and I took the sling off they gave me after about 3 or 4 days, although occasionally I do leave it on at night because it does help a bit. Now, in about a week's time, I am going to see the surgeon again and have the dressings removed. I'll be able to see the wounds. He'll tell me his findings. He'll tell me how I'm progressing. Hopefully I'll be able to stretch the arm a bit. I can kind of do that. It does hurt a bit, but it's okay. In fact, this is the furthest I've lifted it since surgery. And then hopefully in just over a week I will start physiotherapy twice a week to get more movement again. They reckon in about 5 months I'll probably have 80%, 85% movement or so. And then, I think it can take up to 6 to 9 months, even a year or so. Hopefully not in my case, but you never know, to totally heal. But I'm happy I had it done. I have no regrets. Remember, most people with calcific tendonitis will not need surgery. A few do. There's nothing to fear. I'm your biggest phobic of surgery. But believe me, a little bit of discomfort, but it's better than what you will have had before. And remember, think of that surgery. When you're recovering, you are on the road to recovery. After that surgery, you are on that road and you are recovering. Any questions, let me know. After this video, I'll show you the bandages and everything and a couple of photos. But any questions, do contact me. And good luck. Don't be afraid. You can speak to me if you feel you've had the symptoms or whatever. Ideally, contact your doctor, contact a health professional. I'm not a health professional, but I am a layman who has suffered from the issue of calcific tendonitis. So I'm not an expert, but I can talk to you as a patient from a patient's point of view. And I do wish you all the best. Good luck, and let me know how you go. Bye-bye. Hi there again. There's a couple of things I just want to quickly clear up. Earlier I said that I had a high blood pressure when they measured my blood pressure after surgery. They measured it before and it was a little bit high too. It wasn't actually high at all. What I meant to say was when they measured my pulse, I had a high pulse rate, which is different from having high blood pressure. I did not have high blood pressure. I had a high pulse rate, which quickly sorted itself out. The other thing is, when I came home, I haven't been in pain. I've been in a bit of discomfort and been a little sore. The reason I take painkillers still is because where the calcium was and where they opened me up is where I lie down. So it is sore. It is tolerable, but the painkillers help. But I wouldn't call it painful. Hope I cleared that up. Thanks very much. Take care. Bye-bye.